Good afternoon, everybody. Today is November 20th. My name is Scott McGann with the Falmouth Health Department. We're doing our weekly COVID-19 update. The phone number for the Health Department is 508-495-7485. Our email is health@falmouthma.gov, and the website for the town is falmouthmass.us. So as of today, as of last night, there's 341 cases since the beginning on March 19th. There's been 32 confirmed cases between November 4th and November 19th, about 90%. Of course, as we've added a lot of cases over the last more than we normally do, the number out of isolation drops because they're more recent cases. Falmouth is approximately 14% of all cases, which is about what we would expect based on population. Last week we were 14.7, which shows that that's a pretty big 1 week decline. That shows that we've been doing a bit better than some other towns in Cape, and we'll show you that in a bit. And again, of course, the VNA, the Visiting Nurse Association, the CTC, myself, everybody at the health department, continue to do the isolation and contact tracing on each case. So coming here with a weekly case trend, we had a really good stretch from May all the way till about early November. Late October, where we've been pretty much almost every week less than 10 cases per week. As you can see, over the last 4 weeks, we've been up in the 9 to 16 per week range, and so our cases have definitely gone up. We're no longer in that less than 10. I'd like to see it go down less than 10. It's going to be really hard with holidays coming up. We'll talk about that and the amount of cases that are occurring in the state. On our total new cases, you can see that the very end, the far right, you can start seeing that line starting to go up a little bit more sharply than it had been in the past, because instead of trickling along with less than 10 cases when we were testing 1,200 people a week is a really low number. You get a 5 or an 8 in a given week, and you've tested 1,200, you've had a really good week. Now we're starting to see it in a bit more. So basically, instead of averaging a case and a half a day, we're averaging more like 2.3 cases per day. When I get into talking about the color charts, we had the gray, the green, yellow, and red. The state no longer does a map, so you'll no longer see a map. But it used to be 5 cases or less with gray, 17 or less for Falmouth, adjusted for population, would be green. Yellow would be between 17 and 35, and over 35 would be red. So with our case count being in the high 20s to low 30s, we would be in the yellow based on the old method that the state uses. The new one, it's less than 10 for the gray, 43 or less for Falmouth, 43 or a 5% greater than 5% positivity rate. And if you're both 5% higher than 5% and higher than 43, you would be in the red. Looking at Falmouth, this comes from 9/16 to 9/19. You can see that our our average daily incident rate per 100,000 people is gone from in the 2s to the 3s, back down to the 2s. Now we're at 6.6. Percent positivity, we were below 1 is a really good number. Anything below 2 is okay. We went from 1.01 to 1.38. So we're tricking up. But not, we're still in the green, and we're still not at a spot where we're at 2% or higher. Barnstable County is now at 2.5, and the state is a little bit over 3. I'll show you a slide later that explains a little bit about the state. Barnstable County had, in that same time frame that the state took this report, was 329 cases over 14 days with a 10 per 100,000 incidence rate. If you look at Falmouth again, going back up to Falmouth on 11/19, we're still averaging between around 12 to 1,300 tests per week, which is really good. So we are testing higher. And there's another slide that'll show you how we compare to other towns on the Cape regarding how many tests we do. This is from the county. This is the amount of cases since the beginning, each day's, or actually it's every 3-day number, 3-day average. You can see I put a orange dotted line that shows that we're as far as case counts are concerned, early November where we are now is somewhere matching or a little bit higher than even what we were in April. So we definitely have an increase of cases on the Cape. This is the chart I wanted to show you. This is all the other towns on the Cape. You can see that towns like Barnstable and Yarmouth and Bourne were in the yellow or the red. You can see that in total number of tests in Barnstable. If you go to the total test, the first one is 24,187. We're 23,267. So we have less population than Barnstable. So we're pretty much testing at a very aggressive rate compared to some of the other towns. And we have more places that we can test as well. We have the hospital, we have a convenient MD, we have CVS. You can see that the outer Cape towns, the smaller towns, maybe less travel in and out, off Cape, so forth, tend to have less cases. And then the Vineyard in Nantucket had a bad week or two as well. As far as the state, this comes out around 4 or 5. I think it's 5 o'clock now. I should change that slide. I think it's now 5 o'clock. The state's averaging about 2,500 cases. Testing somewhere between 7. On Mondays, you'll see a little bit lower coming in off the weekend, but usually somewhere in the 70 to 90,000 per day tests. Positivity for that 7-day positivity is 3.1. Again, over 2 is not good. Active cases somewhere around 34,664. Hospitalizations is 917. ICU is 181, and patients in hospital. Okay, the average age was 66. The average age of death was 81, with 27 deaths on this particular day. Average turnaround time for tests, as we test more, it was a little bit slower this week. It's basically 2 days. It takes about 2 days to get a test. I've heard worse and I've heard better, but the average for the state, they say, is 2 days. If you look at the far right, you can see by age group that you see mostly under the age between 0 and 39 is where the bulk of the cases are. We're doing a better job with those over 60, where you can see a lot less cases. I think we've gotten a little bit smarter since the spring, and we've done a better job with the elderly population, with the older population, the seasoned citizens, so to speak. Again, this chart also shows it. The red and yellow would be showing you what those over the age of 70, red be 80. Early on, we were getting most of the cases. That doesn't mean that cases from under the age of 30 were less cases. It was just that we weren't testing. It was a little harder to get a test, and we were testing those that were most symptomatic, so that's why it showed up that way. But now that we've have a much better access, many more tests, as I previously stated, you can see that the people that are moving around, working, going to school, going to their activities, going to gatherings and so forth, account for far more of the cases. All these metrics, the 7-day average of confirmed cases is up 1,000% from earlier in the year. Our testing rate continues to climb. It's hopefully plateaued. That number needs to go down. Hospitalizations continue. I mean, from early October, say, almost essentially 40% higher from Halloween. That's very high. And the death rate the daily deaths has been from the teens in late October now to averaging in the mid-20s. This is a daily chart that has the confirmed cases since March. I added, there's no math or science, I just added that dotted reddited line because case count numbers might be similar to what was happening in May, but the availability of tests is much different. So I think the graph, if we were testing like we are now back earlier on, obviously we didn't have enough tests and we just had to make the test, they had to be invented and all that stuff, that you would have seen a curve more like that red dotted line. It would have been some number much higher. For example, I took a few of dashboard dates. I took 4/24, which would be April 24th. We had only done 200,000 total tests. On May 21st, we had done a total of 500,000 tests, and we're currently doing 80,000 a day. So what we do in a week would take care of what a month was before. And since we're testing so much more, we're going to find more. We find less sick people, and we account for them because the idea is to get those out before they get to somebody that is at high risk. So I just thought that was something to show you that even though the numbers are quite the same, it's not in terms because I don't think we were capturing nearly enough earlier on. We're catching much more people. Percent positivity, again, number, you want to be less than 1 is great, less than 2 is still okay. You can see where our line is the dark blue, which shows we're at 3. But if you take, and the light blue tells you the student body testing of higher education. So if you take out higher education, you end up at the orange. So our real positivity, if you take out all the school tests that are happening random, healthy, non-symptomatic, obviously that test rate's going to be lower. Now we're at 5%, and that's getting up really up there too high in the percent positivity. Hospitalizations were up 310 from last week's presentation, 917. Cape Cod Hospital has 9. The last report, 1 in the ICU. Falmouth Hospital has 3. So if you've been listening to me before, those have usually been 0s, 1s, maybe 2s. Those have gone up with the case count going up. I also went back to a couple old dashboards on April 23rd. The state reported an 8% hospitalized. I ran some numbers. This isn't perfect because cases, there's a delay to hospitalizations, but roughly between 11 and 11/19, a little under 3% hospitalization. And that's because, again, going up to the previous slides, you have more healthy people being tested, and some of those positive cases don't end up in a hospitalization for the most part. So that's where we're at with that. ICU is up 30 to 181, and intubated is up 7. So you see that's not quite as growing as much as the previous slide of 310. I think it's because, first off, we do a better job at the hospitals. We know a lot more. And also, the hospitalizations generally can be a lot less people that are younger, meaning instead of being a lot of people in their over 65, it might be some people in their mid-late 50s or so forth. But so the hospitalizations, though, are going up. It's not quite going up at the same rate, it seems, at least to me, that the ICU and the intubations aren't at the same rate. They are going up, but not at the same speed. Hospitalizations, again, here's the curve before. Now our curve is here. So even though our case numbers look like we're matching, the hospitalizations are not, which indicates that, first off, that we're doing a better job protecting those that are most vulnerable. Long-term care, we're doing okay at our long-term care here in Falmouth. The deaths went from 6,538 in a week to 6,645, so some of those deaths are still happening in long-term care, unfortunately. So as far as COVID testing, nothing has changed. You're still able to get it at the walk-in clinic, the community, such as Convenient MD, East Falmouth CVS, Cape Cod Hospital, through Cape Cod Healthcare at the phone number here would be called an appointment through your physician. So that hasn't changed. The types of tests haven't changed. Again, we're trying to I'd love to see some cheap, readily available, fast, reliable PCR, but we're not quite at that point for everybody, which detects viral DNA. It takes a couple days to get your results. That's your confirmed. We are still getting some antigen. We treat antigens like we could treat PCR, though we ask those people to get the PCR test after a positive antigen. Those are considered probable, but they're treated the same. Antibodies are really not a lot of people getting the antibodies. That doesn't really tell you. It suspects that you may have had a past infection. So antigens are rapid, PCRs are slower, but PCR is the gold standard. So nothing's changed with that. Social distancing and face coverings, continuing diligence with social distancing and face coverings. Nothing's changed with that. Hand washing, hand sanitizing is as important as ever. Quarantining upon arrival, the travel orders are very important. Even in Massachusetts now, you have to treat, you really should be treating going to another town in Massachusetts, somewhere on the North Shore or whatever, in the Worcester area or wherever you happen to be. If you're traveling for the holidays, that is still a problem in our own state. So if you're traveling, definitely. The only states I think now that are low risk are the Great White North, so that'd be Vermont, New Hampshire, and Maine. You want to avoid gatherings, parties, indoors without social distancing. Stay at home when ill. If you don't feel well, get a test. We do 1,200 tests a week. It's not hard to get a test, here in Falmouth anyway. And, of course, follow the state guidance. Thanksgiving. And we won't be doing this next Friday, so happy Thanksgiving. Well, Thanksgiving's next Thursday, so happy Thanksgiving. CDC is asking that, gatherings with family and friends who do not live with you can increase the chances of getting or spreading COVID-19. So limiting who you're going to be with in Thanksgiving is going to be important. The state of Massachusetts is also wants you to consider doing this with immediate household family members only. If you are traveling, then some of the do's are mask wearing, do as much outside as you can, separating out your tables, not sharing the same spoons and so forth, limiting anybody who's not feeling well, obviously. Visits, keep them short. Things you don't want to do is sharing food and drink, same spoon, shaking hands, hugging, singing, dancing, shouting, long duration events, and so forth. The guidance is on, you can just Google it. The guidance, there's a lot more guidance on here than this slide shows. But as a public health person, that we are nervous about Thanksgiving. People get together on Thanksgiving. You know, back when we were early in the summer and we had no cases, it wasn't here, right? If you don't have any cases, it's really not here. Now you're going to be importing it. So if you travel to a town, I don't know, you travel to Fairhaven, or if you're traveling to, you know, or having somebody come from another town, it's just the first town that popped in my head, and they bring it here, then you're going to have another, you know, another cluster created. So you want to avoid, you know, it's tough that Thanksgiving, you know, it's happening at the same time we're having the increases, but there will be an increase, I'm fairly certain, as a result of Thanksgiving, as people are still going to, a lot of people are still going to continue to go travel and go to relatives' house or friend's house, and it's usually generally inside. Everybody eats and hangs out and watches football or whatever they watch, and that's really going to lend to spreading. And so we want to avoid that. We also want to avoid, if you have kids coming home from colleges and so forth, that's also going to be a risk. And there's no doubt about Thanksgiving's definitely going to be risky this year. So, you know, for example, I normally go to Maine. We're not doing it this year. We're going to have it just us. We're not going to see anybody. You know, if you do it, then you need to think about some of the basic social distancing and mask wearing as much as possible, and just trying to minimize it. And again, there's a lot more detail on, if you just put in Massachusetts, you know, COVID-19 guidance for Thanksgiving. You'll find a ton more information that I couldn't fit on a slide. But that's what I got to say about Thanksgiving. As a recap, state metrics are increasing rapidly. Once they've gotten over 2% positivity, it gets really hard to control. Falmouth cases are on an upswing. It continues. We're doing better than a lot of towns are, especially off Cape. We are doing better, but we are seeing an increase, and we need to be diligent. Otherwise, that increase, we could easily be red in a week. So we want to make sure that we keep up the good fight. And again, think about, I have space there, but think about your Thanksgiving plans and trying to minimize interactions. This is the worst time of year to try to do that. We got Christmas and Thanksgiving and Christmas coming up, and Hanukkah, and, you know, and people get together. This is when you go see your relatives. And some of your relatives might be your grandparents that are elderly. We have to think about them, and it's going to be tough for everybody. So, again, we won't do an update next week unless something really pops in. Town hall's closed. I think I'm going to take a long weekend, so we're not going to do this on Friday. If you have any questions, again, call the health department. We're around, and we'll see you in a couple weeks. Thanks.